It's time for a little girl talk with our, again, Fox hometown expert. Here is Alana with more.
All right, guys, it's Tuesday, so you know what that means. We're at the Institute of Women's Health, and we're talking girl talk. So if you have questions about it, we definitely have some answers. At least Dr. Evangeline Ramos-Gonzalez does. Thank you for talking with us today.
Oh, thank you for having me.
And we're actually talking about something that many women might have that they don't even know about.
Right, uterine fibroids. Actually, as many as 3 out of 4 women will develop uterine fibroids sometime in their lifetime, primarily during their reproductive years. And many don't know it, like you said. A lot of women don't have any symptoms, and other women, unfortunately, do. They may complain of very heavy or very painful periods. They may complain about pain that they have all the time, pain that's worse during their cycles, pain with intercourse, back pain, leg pain, you name it.
Wow. Well, what's really interesting about this is that you might not know you have it because you might not have any of these symptoms.
Right. A lot of women don't, and they are diagnosed incidentally at the time of their annual pelvic exam, or sometimes incidentally during their prenatal ultrasounds in pregnancy.
Okay. Well, of course, we're bringing this to you because it is important to know. So tell us, of course, we have all these symptoms that nobody wants, all that pain and angst, and absolutely not. But why is it important to make sure that you do or do not have these?
Well, the main reason is because they can tend to grow. They tend to grow slowly. Now, the first thing that I do tell my patients, these tumors are not cancerous. They rarely turn into anything cancerous, but they can be associated with these symptoms. They start off very small in the muscle cells of the uterine wall, and they can grow. And as they grow, they become more symptomatic, more problematic, more difficult to treat. And so that's the main reason that women want to know that they have them. If they're in their reproductive years and they haven't had their family yet, they may want to know that they have them so we can help improve their chances of fertility or also reduce the risk of complications during pregnancy.
Actually, on that note, who is at risk for these fibroids?
Well, basically any woman who has a uterus, unfortunately. African Americans actually as a race are more commonly noted to have these as well. At a younger age, they may have larger ones, they may have more numerous ones, so that is something that we've seen as well.
Well, I'm sure you have plenty of ladies at home, you know, they're thinking just the same way that I'm thinking. What would you suggest to them if they have this urgency of maybe needing to get checked?
Well, first and foremost, I recommend that they have their annual checkups, regularly, once a year. And if they develop in between their annual checkups these symptoms or something that's different with their cycle, something that's different as far as pelvic pain or bloating or an enlarged abdomen, something that they can't explain, they need to come to see their doctor sooner than their annual checkup so we can make sure everything's okay.
Oh man, good information to know, and thank you for letting us know. And of course, if you missed any of this, it's happening every Tuesday, and we're calling it Girl Talk because this is very important information, especially ladies, for you to know. And if you missed anything, please head over to their website. It's ifwh.org, of course, for more information. And stay tuned till next Tuesday because we have more Girl Talk. Even those topics you don't want to discuss, you got to discuss it, and we have plenty of answers for you.
Thank you, Alana. That's some great information. You're right. Sometimes we don't want to talk about it, but it's information all of us with a uterus need to know about. If you want more information on the Institute for Women's Health, they're on McCullough Avenue. The number is 210-226-9705. The website, ifwh.org. They're also on Facebook, and you can follow them on Twitter.